Hello. Um, Real quick, a rundown of the cranial nerves 1 through 12 with a visual. The first cranial nerve is the olfactory nerve, and it is a sensory nerve. As for sensory, it controls the sense of smell. And this is how it looks like. A transverse plane, that right there is the olfactory nerve, and it goes and sits right on top of the nasal cavity. So that's the nerve in the brain, and it stems to right there. Second nerve is the optic. It's a sensory nerve, and it controls sight. So this is the optic right there, and it touches the back of the eye. Third cranial nerve is oculomotor. It is a motor nerve. Controls pupil constriction and extraocular muscle. So the oculomotor stems from right there, and it divides into two at the end, right in the eye. Fourth is trochlear. It is a motor nerve, and its sole purpose is extraocular muscle movement. So right next to the oculomotor is the trochlear. It's different because it stems from a different part of the brain. Fifth is trigeminal. Trigeminal is both sensory and motor. It controls corneal reflex, or blinking, simply put. The scalp, teeth, and facial sensation and jaw movement. And trigeminal, you can see it all in this black circle, stems from right there, and it controls the blinking reflex, the jaw movement, and facial sensation right there. Yeah, that's the trigeminal nerve. 6 is abducens. It's a motor nerve, sole purpose extraocular muscle movement. Number 6, abducens. You could see next to the trochlear, it just comes from another nerve. So there's 3 that is involved in eye movement: oculomotor, cranial nerve 3, cranial nerve 4, and cranial nerve 6. 7 is facial, both sensory and motor nerve. It controls facial movement and the sense of taste. Facial is right there. Then it is cranial nerve 8, auditory, or also known as vestibulocochlear. It is a sensory nerve, and it involves hearing and equilibrium. Fancy word for balance. That is right there, the acoustic. Cranial nerve 9, glossopharyngeal. It's both sensory and motor, involved in swallowing, gag response, tongue movement, taste, and saliva. Glossopharyngeal. All of these are clustered. The rest of the cranial nerves are clustered in this part of the brain. And cranial nerve 10, probably the most important cranial nerve. It's both the vagus nerve. It's both sensory and motor. Controls the sensation of pharynx and the larynx, motor activity of swallowing and vocal cords, and sensory in that it controls the cardiac, respiratory, and blood pressure reflexes, peristalsis, and GI secretions. So, Valsalvic maneuver, that is the stimulation of the vagus nerve to lower heart rate, and that's indicated in patients with supraventricular tachycardia. Correct. Cranial nerve 11, spinal accessory, is a motor nerve involved in head movement, shoulder elevation, and motor to larynx. So speaking, shoulder elevation and motor to larynx. That's right here. And finally, we have cranial nerve 12, hypoglossal, which is a motor nerve involved in tongue movement. That's the last one. So there is a quick way to remember. There's an acronym, or a mnemonic. My favorite is OOO, to touch and feel very green vegetables. Ah, heaven. So both cranial nerve 8 and 9 are go by vestibulocochlear and just accessory for that acronym, but both are correct. And to memorize which nerve is sensory motor or both, there's another acronym. Some say marry money, but my brother says big brains matter most. There you have it. Learn it, live it, love it. These are the cranial nerves.